looked at 34,000 survivors of childhood cancer, all of whom were survivors at the 5-year time point. So they made it to that main benchmark that we call 5-year survival. But the question was to look beyond that 5-year survival and look at the risk for mortality. In the past, we've known that 1 in 5 survivors, even the ones who make it to the 5-year time point, will be deceased by age 30. But we looked at this population, especially the group diagnosed more recently. We looked at survivors diagnosed in the 90s compared to those diagnosed and treated in the 1980s and the 1970s, and we found that those survivors from more recent eras are living longer. They have lower mortality rates. The reason we saw lower mortality rates, well, first of all, was specifically lower mortality due to late effects of cancer. So effects that we see long down the road as a result of the treatment that cured their first cancer. So a second tumor down the road, or cardiac disease, heart disease down the road. And we saw lower rates of death due to these key items. And the reason is that children in the 90s actually had less therapy, many of them, than those treated in earlier eras. And this reduction in therapy for low-risk patients is now yielding a long-term benefit of lower risk for second cancers, lower risk from death from heart disease.